Hi, my name is Pam Killeen, and welcome to my podcast, Truth Over Spin, where I like to expose things like propaganda or corruption in science. And today I'm thrilled to announce that we have a very special guest on the show, and his name is Dr. Chris Shoemaker. Dr. Shoemaker is a comprehensive physician from Toronto, Canada, and member of the College of Family Physicians of Canada. He has, in his 45-year career, worked in emergency and hospitalist medicine in both Ontario and British Columbia, as well as serving at 2 Canadian military bases. Since December of 2021, he has worked tirelessly to inform the public of the 40 trillion RNA nanoparticles found in the COVID injections. That is horribly above the 80 viral particles used to create safe immunity to polio. In June 2023, he learned from Dr. David Speaker and Kevin McKernan that foreign, non-human DNA is also in the injections. He is willing to speak regularly on these concerns and declares that we must save both children and adults alike and stop the RNA DNA jabs. His work is crucial. Not only does he want to share his concerns about what they're finding in the COVID vaccines, he also wants to help the vaccine injured. Below, I will put his contact information, but for now, I'll share his Twitter handle or X handle, which is at C Shoemaker MD. So if you'd like to follow more closely the important work that he is doing, be sure to join his X account. Welcome, Dr. Shoemaker. Thank you so much for taking your valuable time to be with me here today to talk about your story. And I think what is most prevalent with your message, which is very powerful, is that you are actually a voice for people who are what I would deem to be vaccine regretters. And I think to lead up to that is I think people need to hear your story because you were vaccinated with the
Mhm.
COVID-19 vaccine and you were trusting of the vaccines. And so maybe we can take a step back and you can talk about the beginnings of when all this happened in, say, 2020.
Sure, sure. I'd be glad to talk about my early days in this whole fight. And it's had multiple levels and multiple times of new information's coming forward. Uh, Essentially, in 2020, I just knew what the rest of the world knew. Seemed to be that people were falling down in China and Italy and were massively ill in certain ways, and something would have to be done to help their health. But interestingly enough, information came out fairly quickly that because people had been studying what to do about a new COVID thing, if it ever came, and they were quickly trying the things that had been recommended for over 10 years. For over 10 years, ivermectin and hydroxychloroquine had been vigorously spoken of, had been vigorously investigated, and were the likely thing to be used if there was another SARS-CoV event. So logically in the south of France, logically in Pakistan, logically in lots of places, people tried, and Dr. Zelenko in northern New York State, they all tried these normal measures that have been talked about for 10 years. But suddenly they were all struck down for talking about it. And we should just and only wait for a vaccine. And all these measures that had been studied for 10 to 12 years were not to be spoken of. And those who spoken of it should lose their license for speaking of it. So that's a pretty massive action by the government. It's a hammer fist reaction by the government to the simple observation of doctors around the world knowing and realizing that a medication, ivermectin, which can mop up and affect a certain kind of virus, not all viruses, but it can affect certain kinds of viruses, and as luck would have it, the coronavirus infection is massively sensitive to ivermectin and or hydroxychloroquine's interruption of its replication and of its ability to harm humans. So let's just say that the governments were doing the wrong things when I picked up how massively they were doing it wrong, and when I additionally picked up, I guess you could call it a paper trail of why they were doing the wrong things. That's when I dove in the huge ways that I have, and I will continue to, because governments have it wrong.
So what exactly happened? I mean, you did get two jabs, and I think I heard you say that you did get COVID shortly after, I think, the second jab. And then all of a sudden you started to question things. And then the Ontario College of Physicians and Surgeons didn't like you too much, did they?
It all just flowed along one from the other, and the colleges of physicians and surgeons were being instructed by the North American college of all colleges, all boards of in the States and all colleges in Canada are regulated by a central board out of Washington, D.C. And that central board of Washington, D.C. takes directions from European agencies as to what to do. So, oh yeah, they reacted quickly.
And consequently, you lost your medical license, and you've been practicing as a medical doctor for decades.
I had a
Now, how did all
45-year,
this come
yeah,
about?
sure.
Yeah.
Yeah, I had a 45-year track record of pretty much excellence, no calls before the college ever. And if you've treated thousands and thousands of patients like I have, including emergency settings where they need chest tubes, including any number of ICU and internally medicine admitted patients that I would have had some care of as a hospitalist, yeah, I'm pretty good at what I do, was always pretty good at what I did, and had zero, I mean zero calls in front of my college in a 45-year career. And I only said two
Yeah, at
things
a
in my
time when
public
we needed
speeches.
doctors, they turned their back on you. Yeah, so
Well, they
it's
turned my
ironic. It should
turned their
never have
back.
happened.
Sure, they turned their back on Dr. Trozy and myself and anyone who was looking carefully at the real science that I mentioned at the beginning of our talk right now, which had already proven both in vivo and in vitro that ivermectin and hydroxychloroquine were the drugs of choice, proven since 2004 to 2012. 8 years of research, 2004 to 2012, showed that those two medications were the best medications if ever another coronavirus came to Canada like it did in Toronto in 2002, 2003, that time frame. Yeah, we were ready. And we even had good pandemic preparedness
Now let's
responses.
emphasize too. Yeah, let's emphasize too, you have a lot of experience in working with hydrochloroquine, correct? So
No
you're
more
not
than
just
any.
speaking off the cuff here. You have a lot of experience. Yeah.
Well, being in the career for 45 years, you know that it's been available for 45 years to treat people going to Vietnam or to the Belgian Congo and they need protection against malaria. These people would take hydroxychloroquine for 7 weeks. Their children would take it for 7 weeks in full clinical dosaging. And everybody was fine and healthy when they came home and they didn't get malaria and they didn't get side effects from hydroxychloroquine. Hydroxychloroquine was also used for people with systemic lupus or certain kind of rheumatoid or rheumatic diseases. And again, with no problem. People take it for 25 years without problems. So it is a safe medicine. Did we have 25 years of study of these vaccines that were invented in the space of 9 months? No, we had no proof of their safety. What we did have proof of was that ivermectin was safe, hydroxychloroquine was safe, and they both were already in laboratories proven totally effective against coronavirus infections. Totally proven.
Now let's take a step back and talk about this paper trail that you mentioned and the lead up into the vaccine story and why we really only had one remedy, if you will, for
Mm.
the COVID pandemic.
Right.
Can you discuss a little bit of your findings here about what you discovered with this paper trail? What did you find out?
Well, thank you for noting that. My paper trail began in January the 15th of 2022. I'd already gotten my 2 COVID shots just in the 3 or 4 months before that. I'd saved myself from COVID by taking just 3 days of ivermectin. 3 days of ivermectin, and I, in my late 60s, did not. I was sick. I was really sick. I was nauseated, felt horrible, itchy eyes, the I felt bad. And within 3 days, not only did I feel fine, I also, my antigen test, the test to see whether I had COVID, went from positive to 0, all in 3 days on ivermectin. So in the week, strangely enough, in the week after saving myself from harm, from my one time getting COVID, was when I also tuned into a little presentation by James O'Keefe. And James O'Keefe had been following everything that Dr. David Martin had been doing. And James O'Keefe got some specific documents from a major in the U.S. military in which the major was communicating with his superiors. And Major Joseph Murphy was stating categorically in a 9-page document that for 12 years there had been study on the medicines, just as I've said, that they were ready to be used. And it's easy to see within the paperwork that they were going to be good and to be useful. And he equally went on to comment that something called antigenic change and the stress of trying to fight an infection that's in the community and trying to fight it and create antibodies, like all the things that would be tried with a vaccine, would be prone to and would definitely be failed. It would fail because there's no chance of positively affecting coronavirus with vaccines. If so, the flu virus or the cold virus would have gone away in the last 40 years because we'd be using something that works against coronavirus. Coronavirus cause most colds that we have. But it's not worth it. It's not worth fighting the common cold with something that won't even make a difference to it. And but to return to the paper trail for a moment, the specific paper trail they found was that in 2015, Anthony Fauci wrote emails back and forth to Peter Daszak in China and wanting to make the virus that they were working on more virulent. And happily for them, in December of 2015, Obama was president when this happened. In December of 2015, they got the news out of Wuhan that the mortal effect of this worked upon virus, worked upon by the Chinese scientists and supervised by Peter Daszak and authorized financially by Anthony Fauci, had worked. The email said, we've done it. And what that meant, it was now able to kill humans. That's a pretty powerful email to read on your screen one day. It disappeared. I never was able to screenshot it, this and that. Mr. James O'Keefe is the person with those specific email receipts, and I would refer anyone watching this to contact Mr. O'Keefe and as it were, confirm it.
And this leads up, of course, to the bioweapon, the vaccine that was developed that you do not call a vaccine. So why is it you don't call this vaccine a vaccine?
Because the people in charge of it, the U.S. Department of Defense, never called it a vaccine. In all of their paperwork, they say what it is. It is a military countermeasure against an entity that they themselves had created. In other words, they wanted the freedom to work on bioharming agents. There are laws in the United States that prevents the United States or its agencies from working on germ warfare in any form. But by working on it in the way that they did and nefariously putting it off to other sites, they were trying to hide the fact that they were working on a genetic warfare type entity, and that the quote-unquote vaccine, which was the response element that would respond to this prepared virus and that would respond to the genomes that were put into both the viral type and also the vaccine type. And the genomes were man-made. So the reason that I know what I know is that they put it in paper, they put it in print, they put it in emails, and the person who has the most information about that is both a physician and a lawyer. And I apologize, I'm just blanking on the name for a second. David Martin. Dr. David Martin.
David Martin,
is the most famous scientist on these points, and I defer to him on all of these points. And Dr. David Martin has multiple proofs of who were doing the work, where they were doing the work, who had the patents, and how it was being worked on literally for 10 years before 2019 hit. So from 2009 to 2019, the people who wanted to make this happen made it happen. And one thing they did for sure, they made damn sure that the vaccine was more harmful than the germ that they could only make slightly harmful. The germ was no worse than a flu virus, except that it was a betterment. It was a flu virus that could be treated with a medication. It was a flu virus that was totally treatable with two medications, ivermectin and hydroxychloroquine. So they banned those. They harmed doctors who tried to talk favorably about their usage, and they were rubbing their hands, waiting for the chance to fool the public and get the public to put it into 75% of arms around the world. Sadly, my arms included. Sure, I'm sitting here looking half decent, but I have massive tinnitus in my ears that I never had before. I have some cardiac symptoms that are not ideal that I treat as best I can, and I didn't have them before. And so I'm way less harmed than some people, way less harmed. No sympathy needed for me. Sympathy is needed for the people who can't walk, who've had a lesion in their spinal cord created, like a gentleman here in southern Ontario who has had that happen to him. And a marvelous film has been made about him, Michael Ush. And he, again, is one of hundreds of thousands of totally innocent people who have been harmed by a worldwide planned circumstance. But the people who had the greatest control over this circumstance were one entity and one entity alone, Again, I refer to Dr. David Martin, and that entity is the U.S. Department of Defense. They literally made the vaccine over that warp speed time. They were ready to make the warp speed because they've been working on it for 5 years before. They didn't tell President Trump that. They said that, oh, well, we think we can do something fairly quickly, Mr. President, and of course it'll be completely safe and effective. And they made it, and they didn't let Pfizer or Moderna put their labels on it until the U.S. Department of Defense had fully, in their laboratories and labs and vats of liquids, till they had made it. And when the U.S. Department of Defense was finished making the non-vaccine, the genetic harm jab, when they'd made the materials ready for it, they let each company in their own way put their labels on it and present it to society. So when you know these things from Dr. David Martin, when you know these things from James O'Keefe and others, how can I as a doctor sit in good conscience knowing that and not say to people, be very careful, be willing to abstain from this product? That's it.
Right. And you had a lot of evidence. You had actually seen the research by Dr. Kevin McCarman. I think David Speaker as well. They had found in the vials that there were DNA fragments in there that really shouldn't have been in there. And you speak quite eloquently about this. Now, can you explain to our listeners what this means? Why should we not be finding DNA fragments in a vaccine vial?
Because if it's done right, there's never any there. I mean, that's assuming that putting mRNA inside lipid nanoparticles is itself a good idea. And the net result was itself a bad idea, a horrible idea, a toxic idea, and it was able to be lethal on its own. But to have allowed 1/3 of the weight of the nucleide process that goes into our bodies, 1/3 of the weight of that is deoxyribonucleic acid. The book of life, the thing that tells you you're you. And because they were putting DNA into your body and allowing your body 1/3 of the weight of every shot that went into you is deoxyribonucleic acid, which has the ability to cross into the nucleus of your cell. And once in there, something called transfection occurs. It's nothing to do with infection. Transfection just means uptake into the same bit of the body that has your genetic karyotype, your chromosomes. So these little DNA fragments get to sit right next to your chromosomes, be worked upon by certain enzymes, and the body just naturally starts to make it part of you. And so that's what they found, sadly. They found that in liver cells of patients and many other tissue cells of patients, both alive and deceased, they have found that the person's karyotype / chromosome material is permanently changed. Their sperm cells, their ovary cells, their spleen cells, their immune cells in the middle of their bone marrow, they are all permanently changed and have genetic material that is not human, and it is certainly not their humanity. And so that's why the attacks occurs, ladies and gentlemen. The reason the attack occurs is it's as if you've had a fresh kidney put into you, transplant. Of course, you've got no medicines to dampen down your immune response, and the body says, that's not my kidney anymore. It's got a bunch of foreign DNA in that kidney, and it's got foreign RNA flags, and it's got foreign spike, none of which is related to this person that I am. My immune system can do one thing and only one thing. It will go at and hammer at and inflame your kidney, or inflame your heart and turn it into myocarditis, or inflame and damage in your immune system, which means your immune system is poor. And you'll get other infections that you wouldn't have gotten. And you'll get other rheumatoid-like illnesses and severe rashes and other things that are wrecking your life. And in my case, tinnitus in my ears. So everybody's got something. Everybody's getting something who have had, especially DNA. DNA, by the way, allows it to go on for 20 years as opposed to 15, 20 weeks. If it was just RNA, it'd be over and out of your system within 15 or 20 weeks, because there's an element of DNA and its ability to replicate within you over time and repeatedly. That's why you've got people with spike proteins still in their body, and their last vaccination was 2.5 years ago, and they're still producing spike. Why? Because their immune and genetic and cellular system has been attacked and includes now material that is not theirs. And that's what the body can't stand. The body always attacks tissues that are inside it that are not of you. The scientists who made this knew this. You can't make something this nefarious and this capable of going to so many cells in so many ways if it's not purposefully and nefariously produced. That's my second reason for making my arguments, and they're well supported by science.
Oh, and I look around, I observe, and I see how many of my friends got so sick after they got the vaccine. One vaccine, two vaccines, three vaccines. I had a very dear friend who was vaccinated and unfortunately within a few weeks passed away. He got a turbo cancer, if you would call it that.
Yes, you
He
would.
was very young. He was a 50-year-old tennis pro. So, seemingly quite fit and healthy. But he collapsed the day after, I think it was, that he got the vaccine, and he leaves behind him a lovely wife and three children. And I can tell you countless stories like that. I'm sure you've heard many yourself.
And they're all medical murder, all of them. That man was murdered. Within 24 hours, the jab, the lipogel within it, the DNA elements, and the spike in particular, all conspired to end his life 24 hours after an injection. Other people, it was 17 or 30 days later. Little Sean Hartman here in Ontario passed away within 20 days of a single shot of Pfizer. He had very intriguing symptoms. The doctors didn't know quite what to make of the fact he was showing up with a bit of a strange chest pain and the like, and a little fatigue and shortness of breath. And he also had these brown circles under his eyes, like raccoon eyes, as we call it. He had bleeding under the eyes into the tissues under the eye. It was never investigated with D-dimer. It was never investigated with any appropriate test to see, is there a hemorrhagic issue here? He was just sent home told to take some Gravol. It wasn't until 10 days later that he died in his sleep. But the clue was there. The clue that his brain and heart systems were both being attacked. And the brain symptoms, it was a sign. It was a sign under the eyes. That shows bleeding in the base of the brain. And there was no trauma involved. I'm an emerge doctor. I've seen that kind of thing when the bleeding at the base of the brain shows the raccoon eyes, and it's because of trauma. It can also occur because a certain kind of inflammation or attack is causing it to occur. In this case, the genetic vaccine was causing the bleeding under the eyes.
Now, there's another doctor here in Ontario who noticed, she is an emergency room doctor. I'm sure you know who she is. And she noticed the elevated D dimers in people who'd been vaccinated and started asking her hospital administration, her bosses,
Mm-hmm.
questions about why am I seeing elevated D dimers in people who've been vaccinated? And eventually, for her questions, she was fired. They just don't want people to know about the consequences of these quote unquote vaccines.
And there's no apologies by any of us who are fighting it, by that wonderful doctor who I do know of, by anyone who's gone up against medical administrations or gone up against public health or their government health, Department of Health within the province. They're all being stonewalled, all being told that they're wrong to ask. Dr. Charles Hoff out in British Columbia did a similarly good job of bringing up the D-dimer issue in his patients in Lillooet, British Columbia, and wrote certain letters to his colleagues saying, hey, we should be on the lookout for this. This seems very strange. He was quickly harmed by his medical college and told to not ask such questions. Doctors are supposed to ask questions. We're supposed to be worried about the health of our patients. If we see some laboratory features that also indicate harm, then we really should be allowed to ask questions. So nobody has a right to stop doctors from treating patients and actively asking questions for society's benefit. That's all I ever did. It didn't involve a lot where I was treating patients. I was just commenting. I became a commentator more in the last 2.5 years. I wasn't allowed to see patients anyway by my college. They said that you're not licensed, you can't treat patients, and we certainly would prefer that you not talk about the poor treatment of patients by the rest of physicians in Canada. Well, we're only poor at treating our patients from the vaccine injuries here in Canada because the governments want us to be poor at it. They don't want secondary questions. They don't want ivermectin for its ability to help a vaccine injury to be used. And the science is so perfect. The science is so usable. The doctors in the States, they're being allowed to use ivermectin for multiple usages, including vaccine injury. They're getting fantastic results. They're getting people who were terribly palsied or had a tremendous Parkinson's-like shaking of their limbs, that was just awful. And it melted away after 12 days on ivermectin. So we're right, they're wrong, and we're not going to stop being right.
No, no. And I think this is a mission of yours, is to help people who are vaccine injured, is it not?
And I would certainly like to be able to do it personally. I would like to be licensed here in Ontario and help people tomorrow. I would be able to,
Good,
but my college doesn't want to revisit
good.
that. I may be reapplying to the college shortly, which I believe I should, because with the new evidence out now, the evidence was not as strong in our favor 24 months ago when my license was revoked, but it's now vigorous that ivermectin is of benefit. Many other drugs are of benefit, and we should be allowed to prescribe them appropriately as physicians.
Yes, absolutely. Now, you're also featured in a documentary, Why Can't We Talk About This? I think you touched on the gentleman who's featured in that documentary, how he got so sick after getting vaccinated. Do
Yes,
you have
Pam.
any updates on his health at this stage in the game?
Not really, because I'm not his doctor. I can't be anybody's doctor just at the moment. But yes, I have some updates I can give because I know anecdotally through friends of his and friends of mine, and I've seen the film itself. And all in all, the same thing happened to an orthopedic surgeon in the States, where he got transverse myelitis, which means the nerves that cross to go to the opposite side of muscles and come from your brain from the right side, but from the brain on the right side, it ends up in muscles on your left side, so it will work. So it has to transverse or go across the spinal cord at the appropriate level. The orthopedic surgeon had his transverse myelitis down around his dorsal thoracic and lumbar area, and because it was that low that the self-attack, the immune attack against the self occurred down at that level, he went paralyzed from the legs down. He can't work as an orthopedic surgeon anymore. He has to sit in a special chair even just to be a human being. That's what happened to the orthopedic surgeon in his early 40s, I believe. Michael, who was in his early 50s, got slower, quieter symptoms initially, but it rapidly progressed because it was up at around C1. It was just below his brain that he was no longer able to transmit a little electrical impulses from right to left or left to right. And so it's worked out that not only have his legs gone paralyzed, but his arms are all massively weakened to only maybe 25% of normal strength or activity, barely able to hold a cell phone to talk to his wife or a friend who might be calling into him. And he's just fading away in a hospice care / chronic care setting with nothing being done by him or for him other than just making sure that his bed is clean and he's able to be wheeled around in a gurney or a wheelchair. That's what's happened to a man who, because on his fourth shot, and he trusted the system and he took shots 1, 2, and 3, and then it was time for shot 4 and he took it. And within 12 hours of taking shot 4, he got these massive symptoms while driving a bus. His bus went off the road because he lost use of his lower legs, and he had almost a seizure-like activity in his brain. And this was all caused by the cumulative effect of the 4 jabs damaging and creating nerve damage in his upper spine. That's the story of the gentleman, and many people should see this wonderful movie. I invite you to tell the audience the title of the movie once again. I'll be
Right.
speaking in Kitchener shortly about it.
Oh, fantastic. Yeah, it's by Rainy Media. It's called Why Can't We Talk About This? I would highly encourage people to watch that documentary. It's a tragic story. And you're mentioning 4 vaccines, but I know people who were devastatingly hurt, after one vaccine. And
Absolutely.
it's
Yep.
on and on and on. I mean, you've heard, I'm sure, countless stories about people who've been injured even with one vaccine.
Yes, I can. And one that reminds me of a story that I know is true from out of New Zealand. You know how people talk about, oh, did you get a strong batch or a weak batch? And proof after proof. Belgium sued Germany at one point, one of the countries in Europe sued another country, anyway, to get the information. And I think it was either Denmark or Belgium suing Germany for the information. And what they found out in their suit, and they had to be told the truth by the other agency, because actually the vaccine was being produced in Germany. 1/3 had nothing in it but salt water. 1/3 had a moderate dosage of the mRNA, and 1/3 had a massive and severe dosage of the RNA plus other elements in it. And that allowed that country to know, well, why are we giving something which is not constant? Why, you don't give drugs that aren't constant. If you get Benadryl or epinephrine injected into you, do you think you have 3 different versions, 3 different strengths, and one of them is salt water? You can't do that. But the governments and these Pfizer's and Moderna have done that because they wanted to see what was the effect of less or more of the agent. Because they're not interested in stopping right now. They're interested in getting us to take even more. And now that they have the experience of knowing what strength of harm to give, it will help them know if they were foolish enough to follow their advice again, it will help them make it more lethal in future.
Now, speaking of some of the ingredients that are found in these vials, I want to ask you about two. One is the SV40 fragments that are being
Sure.
found in the vials as well, and the lipid nanoparticles. I mean, these two entities alone, separately, are toxic and deadly. And these things have been found in the vaccines as well. Can you talk a little bit about each of those?
Lipid nanoparticles are for sure in the vaccine because they're the major constituent of the vaccine. Lipid nanoparticles were invented by a company that Mr. Trudeau invested heavily into, Acuitas, here in Canada, at the University of British Columbia. And none of the vaxes could have their purpose of carrying mRNA if the little spaceships that carry it around, that's what these lipid nanoparticles are, tiny little particles with a fat lining that has an electric charge, and it's able to protect the mRNA for a certain amount of time as it moves you through the body. But here's the deal with lipid nanoparticles. They've been studied for 25 years, and they're uniformly never been brought to human usage because it kills every lab animal that it goes into. LNP technology can't be and isn't being used successfully even in animals because of its lethality. In humans, it's not instantly lethal. It's still no damaging. Anything with LNP is not good for you. And so for them to be saying that we've got new kind of things that are going to come out and they're going to be looked at more carefully than we looked at these first ones, no. If it's inside a lipid nanoparticle, you are by definition doing yourself harm. The other point to make is that in the area of chemotherapy, what were among the reasons that they wanted to use lipid nanoparticles? And they were doing studies in the 2010s. Studies in the 2010s in which lipid nanoparticles, although it certainly couldn't be used for general patient use, they were allowing it to be used in people who had 5 months or less to live. And so hospitals had protocols in which they would be allowed to give it to someone who had 5 months or less to live because they wanted to see how it worked to bring a small vesicle or an agent to a tumor. Can you believe it? I mean, it's an agent that so to now give it to the general population who ought to have way more than 5 months to live, and to say that it's studied enough to know that it's safe. No, it was studied enough to know that it's unsafe and should only be used in experimental situations where the person themselves had 5 months or less to live. So that's what the world has said yes to. That's what science has lied to them about, is using a modality that even before you put the RNA into it or before you put the DNA into it, the carriership itself has a certain lethality to it. Anyone who wants to look this up can look it up. I'm not going to give you chapter and verse of where it all is, but I've read it in enough places from enough experts, like Dr. Paul Alexander out of the US, but who also has wonderful Canadian ties, Geert Vanden Bossche, who is a colleague of his, and so many people who tell us the honest truth. Please, everybody, just stop fooling ourselves. Send this video to any of your members of parliament. I'll sit down and talk with them about any of these points, gladly.
Yes, please do. Please do. And the simian virus 40 as well,
Oh,
that's frightening. Like they found
yeah.
fragments of that in the vaccine as well.
It's a specific element that ended up being part of the original polio viruses. I think they've since been able to get it out of what are currently the polio viruses. But in the original polio viruses and the creation of the polio viruses in the 1950s, simian virus was part of the package of things that went in. A virus from a monkey, and the purpose of SV40, of this particular little genetic key, was it allowed the vaccine element to get deeper into the human body, sadly, including even the nucleus. So here's this agent which has since been banned from other products and since been banned from the polio virus, but it still sits there in refrigerators here and there around the world, right? So they specifically put in this thing that would take it to the very nucleus of your child's brain when they're still inside your womb. That's how powerful it is. It's able to take what's inside it all to as many places as possible and as deeply as possible, and to the nucleus even of the cells of mother, child, or 50-year-old. It doesn't matter. It goes into everyone with that extra capability that no one would invite. Oh, by the way, Pfizer and Moderna lied about it. They lied. They didn't put it into their map that they had to give to Health Canada, and they had to give to the FDA and the CDC. And they obfuscated. They lied. They didn't put it in there. And then there became a point at which they couldn't obfuscate it because Dr. Speaker, Dr. McKernan and others, Dr. Jessica Rose and others were pointing out to the world, this is in there. And so then Health Canada, all they did was take Pfizer's word for it that, well, it can't do much harm. I thought you had scientists at Health Canada. Scientists at Health Canada would know all about the harm of SV40 from the 1950s, and they should have been apoplectic that they were lied to. And from that point on, they should never take advice of the companies. And I will never take advice of those companies who have lied about putting a genetic sequence, because it's not a virus per se anymore. It's a genetic sequence that acts like a perfect lock and key, and the key to get the materials into the nucleus of your own cells. That's what it is. That's why it's so toxic and inappropriate. And it's in every vax that we get in Canada. It's in every vax that they get in the United States if it's made by Pfizer. It's part of Pfizer's formula.
Now, SV40 also can trigger cancer, can it not?
SV40 certainly makes it more likely for you to get cancer. The fact that everything can travel more places is one reason, but it also upregulates and downregulates certain things, like one is called P53. And P53, it has to be at the right level, and if it's not, your immune system's ability to fight and recognize cancer is destroyed. It needs to be healthy. The P53 enzymatic system, SV40 harms that enzymatic system, poisons it. So yes, can we therefore be surprised that people in their 30s and 40s are getting cancers they'd never gotten before? That 7-year-olds are getting bowel cancer? 7-year-olds never got bowel cancer, ladies and gentlemen, prior to 2021. 7-year-olds rarely, it's not common, but it happens. So it now happens because we've accepted a chemotherapy chemotherapy is the wrong term. We've accepted something that will harm our immune system and not allow our immune system to prevent an early cancerous change. So now when a 7-year-old starts to get a funny little cell, it doesn't have P53 to fight it in an appropriate fashion. It's been harmed. The dear child has got a fulminant cancer 4, 5, 6 months later.
Now, you're among a long list of doctors, growing list of doctors that are saying that the vaccine, again, I say that with asterisks around it,
Sure.
is causing more harm than good. You know, there's thousands and thousands of people are potentially deceased because of the vaccine, not just injured, but deceased. Have you looked at some of the recent numbers?
I've looked at it to the extent that every country on earth had a 25 to 45% increase in death rate. So it meant that instead of 1% of their population dying every year, they went up to 1.45 or 1.80% of the population dying every year. It's not that noticeable because, hey, if 98% of people are still alive, the general population doesn't notice it. But to have a 40 to 50% increase from the 1% up to 1.4 or 1.5% is the new death rate that's now normal in the world. That shouldn't happen. In fact, the statisticians say it should only happen to a 10% level. A 10% level in mortality increase should only happen once every half of the length. No, I want to get this right. The 10% elevation should happen only once every 300 years. It'd still be terribly, terribly rare. Once every 300 years. A 40 to 60% elevation of worldwide mortality should only happen once in half the age of the universe. Once every 3 billion years. That's how statistically rare it should be. We've made something that should only happen once every half the length of the time of the universe, and we've made it happen in 3 years here in little old Earth. And it's not.
And look at the infertility. Look at
the same infertility is happening at the same level. The 40 to 60 to 80% worsening of fertility in a number of countries. Egypt is one that's listed it. There's an Asian country I can't quite specify. I think it's Japan. They are specifying and knowing that their fertility rates, they're bottoming out. They're bottoming out. Why? Because these points, these genetic points, and the DNA elements that make these genetic points and harms and attract the body to damage the ovary, They're going into everyone's ovaries. And it doesn't matter whether you're a 12-year-old ovaries or a 42-year-old person's ovaries. Everybody's getting it there. Can we now agree, ladies and gentlemen, that it's time to ban the shots? Let's just ban them for 3 years. Say we're putting a 3-year hold on this thing because too much bad has happened. Believe me, you will find nothing in the 3 years that follow that will tell you you made a mistake to stop it right now. The mistake would
But
be
what
to
about
not
the
stop it
mRNA
right now.
technology? I mean, they're still talking about putting it in other products and using it in animal vaccines and so on. I mean, it's this technology that is really what you're criticizing the most here, is it not?
Put it this way, do you ever see people charged with murder start to give up their lie and start to say, oh, well, it's really as bad what I did and I'm planning to do more? No. Murderous people don't start telling the truth just because it's 3 or 4 years into their murder plan. So that's why I'm not surprised that they're continuing to promote the product inappropriately. As humans, we have to fight. As humans, we have to fight. If we don't fight, we'll be way less than human in another 20 years. Our death
Yeah.
rates will continue to
Do you
skyrocket.
see
And
anybody? Go
sorry,
ahead.
no, you go ahead now, please.
I was just going to say, have you seen any positive results in, say, the CDC advisor recently resigned at the FDA. RFK Jr. pulled the COVID vaccine for kids and pregnant women. The United States canceled H5N1 Moderna contract for $700 million because it failed to meet scientific standards. I mean, are you seeing any positive trends happening here where people are starting to understand that this isn't the way we should go? And is these mRNA vaccines?
They'd be positive enough if they were being followed another 7 days later by an outright ban and halt and pause on all mRNA technology. That's the thing that isn't happening. All these little things are signs of relative benefit. But to be honest, when children who have immune disease already, they're still eligible for the vax. They're the last children who should be getting this because it effectively damages their immune system more, and children don't need it to prevent them from getting COVID. So no child of any age should get it. No adult of any age should get it. And right now, the regulations do not discourage that. There are very few countries that are really actively not allowing COVID shots within their borders. Certain Eastern European countries are beginning to do that right now. Certainly Slovakia got huge information lately of the terrible effect on their fertility about having used the vax. And they are 90% done with this happening. They are, I think the last and final legal framework hasn't been quite done, but Mr. Fico, who is the premier or the prime minister there in Slovakia, he doesn't want to see his people, his population, his genetic stock of Slovakians continue to be damaged. And nor do we want that for Canadians, nor do we want that for people in Uruguay or in the United States. Let's stop harming our ovaries, our brains, our hearts, and our immune systems. And that's what's happening if you take any, and I mean any, mRNA product.
Now, are you concerned about this aerosol vaccine that they're developing here in Canada? Have you heard or studied that at all?
I know of it, and it's just part of the same multi-headed monster. It's pathetic in as much as it would create an environment where a non-vaccinated person is more likely to inhale or have elements of this come into their body than if it didn't have that design. So they've now essentially made it so that it can get into you from lettuce, it can get it into you from the breath of a person sitting you on a bus beside you, and they want it to be across the world. They want it to be that way. So it's a massive, massive
Right.
democide
Well,
isn't,
it's a
or
depopulation. Yeah, it's a
genocide is
genocide.
not a strong enough word. It's human harm on a global scale. That's what someone wants. I'm pretty sure the name of one of them happens to be Gates. Sit him down in a deposition and get him to say to who the rest of his nefarious friends are. Who are you really? Gates is so powerful. Gates makes so many things happen through Navi and through the World Council, the WHO, the WHO. He makes it all happen. He writes the checks. It happens.
Yeah, but Dr. David Martin has been very clear on the population control agenda, and he's been from day one warning us about what's going on. And it's pretty clear to me that they wanted certain people out. I mean, I've had friends come to me who work at senior homes, and they say as soon as the vaccine came out, that's when the death rate went up. that before the vaccine came out, the death rate was normal. After the vaccine comes out, all of a sudden, the aged, more of them are passing away. It's just a cause and effect relationship that unfortunately a lot of people still can't see. But I know a lot of people out there are also very awake and noticing that there's a real problem with this vaccine and this whole narrative, this whole agenda.
It all started February. By the time we got to February, March of 2021, by the time we were 2.5 months into this, every index that was looking carefully at the possibility of a vax producing harm was massive signals, massive danger signals. I don't call them safety signals. Society still calls them safety signals for some stupid reason. You're not testing what a vaccine might be doing in terms of elevating death. That's looking if there's danger signals for using the vaccine. But they obfuscate by saying, well, there aren't enough safety signals. There aren't, the safety signal has not been kind of, shown in this situation. Stop calling it a safety signal. It's a danger signal is what it is, and it is bad enough to stop these jabs. And there's just no good going on. The bad people are winning out in the public relations war because they control the media and tell the media what to say. I'm not going to be on the CBC News tonight with a clip from this, I don't think, but I ought to be, because Dr. Trozy, Dr. McCullough, Dr. David Speaker, Dr. David Martin, and I could list 300 other people. We should all be on the news because we're telling the truth.
I agree. I agree. Before we sign off here, do you have anything else that you want to share with the listeners? Anything up to date, anything current, anything about the work that you're doing? I'll be sharing your contact details below in the show notes, but is there anything else you want to share before we sign off?
Well, if anyone would want to assist me, as I remain totally underemployed in this life and living here in the basement of a friend's home to keep things going, there is a Give Send Go for me. If someone wanted to send, it's Give Send Go, and it's /DRSHOEMAKER. I would certainly appreciate it, and I would be able to continue to do my modest effect with help like that. In terms of information that's out there that's worrisome, the new information about Replicon. Replicon was first used in Japan. The Japanese haven't taken it up much. They're being very doubtful about using it. But now the European Union and the United States of America, and therefore Canada, have all agreed to put this replicating virus where it's built for the mRNA to behave like DNA, as if the DNA bits in there weren't good enough to create the harm they want. They have made it so that the RNA elements putting in can self-replicate as if they were bits of DNA and keep making it for 20 or 30 years. You won't last that long, by the way, but it will just be ongoing. So for this Replicon, which can be shared through exosomes and breath out to other people to be the means of delivery, and the new means where the mRNA will self-replicate for more than just 3 years and turn it into 20 or 30 years, it's awful. It's awful news. And how scientists in our countries are agreeing to this, it just saddens me extremely.
I agree. I agree. It's frightening what's going on. But thanks to you and so many other doctors like Dr. Trozy and so many others,
Yes.
the truth is coming to the fore. We need to support you. I encourage everybody to support the work that you're doing. And perhaps in another few months, we can do an update and see if there's been any progress politically. Are you going to be talking to any politicians or any of the scientists out there that are putting out all the false information? Are you going to be doing
Uh,
any kind of activism?
I'm not a. I'm, I've tried. I've tried to talk to every premier in Canada. Can't get through the door. I didn't bother trying to talk to Trudeau. I knew he'd never be interested. Trudeau was himself being advised by Carney how to behave and what to do throughout the entire pandemic. The harms that he did Canadians were out of the direction of harm from Europe, where Mr. Carney was. And Mr. Carney was in close contact with the WEF and with the European Union, and they're all behaving like psychopaths. So we'll carry on, me and my little way.
Okay.
Sitting in a friend's basement with my tie on. That's all I can do right now.
Well, the world needs more doctors like you, and I hope you get your license reinstated. And I'm sure that you're going to find a following of people who are going to support the work that you do and, confront the politicians and say this nonsense, this crime has to stop.
And I'm certainly willing to talk to any of your colleagues in the special media of North America. And so we'll cooperate in that direction. And thank you very, very much, Pam. It was great talking to you today.
Thank you for joining me. Thank you for taking your valuable time to join me in today's podcast. Please join me in my other podcast, Circadian Reboot with Pam Killeen, where we discuss other matters related to circadian biology. If you would like more information about my health coaching services, please visit my website, www.pamkilleen.com. And now for the disclaimer. The information on this podcast is for educational purposes only and is not intended as medical advice. We are not licensed healthcare providers, and our content is not a substitute for professional medical diagnosis, advice, or treatment. For personalized health guidance, or if you have a specific medical concern, please consult a qualified medical professional. They can assess your individual health needs and offer recommendations tailored to you. By listening to our podcast, you agree to this disclaimer. We assume no responsibility or liability for actions taken based on the information provided herein.